9 warning signs. Your kidneys are failing and the crucial tests that can help you avoid dialysis. This information is not distant or rare. More than 808,000 people in the United States are currently living with end-stage kidney disease, also known as ESD. At this stage, the kidneys have nearly lost all function, leaving patients with only two options: a kidney transplant or lifelong dialysis. Unfortunately, the chances of receiving a transplant are extremely low. Over 100,000 Americans are on the national waiting list, yet 87% of them still do not have a donor. As a result, nearly 70% of patients must start dialysis just to survive. Dialysis treatment is exhausting, and it is also costly, with an average expense of around $42,000 per year. What is most concerning is that the majority of patients do not realize their kidneys are failing until the disease has advanced. People may not notice any significant changes in their urine, including the amount, color, or smell. Some individuals wake up and urinate more frequently at night, but this is still not a clear warning sign. Because kidney disease progresses silently, understanding the early warning signs is essential to detecting the problem when there is still a real chance to slow or even reverse the damage. In this video, I will explain 9 major warning signs that indicate your kidneys may be failing. I will also show you the most accurate medical tests doctors use to measure kidney function, so you will know exactly what to expect when you go for a health check. Before we move forward, it is important not to panic. Having one or two of these symptoms does not automatically mean you have kidney failure. The purpose of this video is to help you recognize the signs early, understand them properly, and gain the knowledge necessary to protect your health. You do not need to diagnose yourself. Simply pay attention to symptoms that sound familiar and make sure to discuss them with your doctor along with the appropriate blood and urine tests. If you want to know how to prevent kidney failure before it controls your life, you should watch this entire video. If there is one health video worth watching this year, I hope it is this one. Rewatch it when needed and share it with as many people as possible. Do not forget to subscribe to the channel and turn on notifications so you do not miss future important videos. To understand the symptoms, we first need to understand the critical role of healthy kidneys. The kidneys are the most advanced and precise filtration system in the human body. Each day, they remove excess fluid, eliminate metabolic waste, regulate electrolytes, and maintain stable internal conditions. When the kidneys are damaged over a long period of time, their function gradually declines. Once their activity becomes extremely limited, the condition is classified as end-stage kidney disease. At this point, the kidneys are too damaged to perform their essential functions, causing fluids, electrolytes, and toxins, especially urea, to build up in the blood instead of being filtered out through urine. This harmful accumulation leads to many severe symptoms that will be explained shortly. End-stage kidney disease frequently affects individuals with long-term underlying conditions such as high blood pressure, heart disease, and diabetes. These disorders damage the small blood vessels within the kidneys over time. In medical practice, chronic kidney disease is classified into 5 stages. Stages 1 and 2 usually have no symptoms and are easy to overlook. Stages 3 and 4 show more noticeable signs as kidney function continues to decline. Stage 5 is the final and most dangerous stage, when most patients require dialysis or a kidney transplant to survive. It is important to understand that not all symptoms are caused by kidney disease alone. Many of the same signs, such as fatigue, swelling, itching, and shortness of breath, can also be linked to heart conditions, liver problems, thyroid issues, diabetes, or even medication side effects. That is why symptoms alone are not enough for diagnosis. Blood tests, urine tests, and kidney ultrasound are the most accurate tools to confirm the condition. So what symptoms suggest that your kidneys may be in serious trouble? In the next section, we will go through the 9 most common and important signs of end-stage kidney disease. Identifying them early can help you take control of the disease sooner, improve your treatment options, and maintain a better quality of life. And once again, if you experience only 1 or 2 of these symptoms, it does not mean you have kidney failure. Instead, it is essential to consider 3 key questions. How long has this symptom been appearing? How often does it occur? And is it stable or getting progressively worse? These details will help your doctor accurately evaluate your kidney health. Symptom 1. Fatigue. Persistent fatigue is one of the most common symptoms seen in people with advanced stages of chronic kidney disease. As the kidneys begin to fail, they can no longer effectively remove waste and toxins from the bloodstream. These harmful substances build up inside the body and cause a constant feeling of exhaustion, even when a person has not exerted themselves. Another important factor is that the kidneys are responsible for producing a hormone called erythropoietin, also known as EPO. This hormone stimulates the bone marrow to produce red blood cells. When kidney function declines, EPO levels drop, leading to anemia. With fewer red blood cells to carry oxygen throughout the body, fatigue becomes much more intense and persistent. Fatigue can be even more noticeable in patients who have other chronic health problems, such as diabetes, high blood pressure, a history of heart disease, depression, or sleep disorders. The combination of toxin buildup, anemia, and these underlying conditions can make even simple daily tasks like walking, cooking, or bathing feel overwhelming. Interestingly, light physical activity, such as walking for just 10 to 15 minutes a day, has been shown to help reduce fatigue in kidney disease patients. Some doctors may prescribe erythropoiesis-stimulating medications to address anemia, although their effectiveness in relieving fatigue is still debated among medical experts. Fatigue typically becomes more obvious from stage 3 kidney disease onward, especially in stages 4 and 5. However, similar exhaustion can also appear earlier, even when kidney function is only mildly reduced, particularly in people with diabetes, heart disease, or chronic anemia. It is important to recognize when fatigue may be a warning sign. If you feel so tired that you struggle to care for yourself, feel dizzy when standing up, or become short of breath with minimal effort, these are red flags that require a medical evaluation as soon as possible. You can ask yourself 3 simple questions to help monitor your condition. Has this fatigue lasted for more than a few weeks? Does resting help you feel better? Or do you wake up just as tired as the day before? And is the fatigue slowly getting worse over time? These observations can provide valuable clues for your doctor. Finally, it is essential to understand that fatigue is one of the least specific symptoms in medicine. It can be caused by heart problems, lung disease, thyroid disorders, depression, poor sleep, sleep apnea, or even the side effects of medications. That is why the most important step when experiencing persistent fatigue is not to guess the cause, but to get the appropriate blood and urine tests and speak with your doctor to determine the true reason behind the symptom. Symptom 2. Muscle cramps. Muscle cramps are a very common symptom in people with chronic kidney disease, especially those in stage 5. These sudden, painful spasms often occur at night, during hemodialysis, or shortly after a dialysis session. The primary cause of this problem is the imbalance of key electrolytes in the bloodstream, particularly calcium, potassium, and magnesium. At the end stage of kidney disease, the body can no longer regulate these minerals properly. During dialysis, the blood can become overly alkaline, a condition known as alkalosis. When the blood shifts toward a more alkaline state, electrolyte distribution changes, causing the muscles to contract abnormally and leading to severe cramping. Another contributing factor is low magnesium levels after dialysis, a condition called hypomagnesemia, which can trigger frequent muscle spasms. Although patients with end-stage kidney disease often have high potassium levels, potassium may occasionally drop too low, resulting in hypokalemia. This can occur due to vomiting, diarrhea, medication side effects, or electrolyte changes during dialysis. When potassium levels fall too low, the muscles become highly sensitive and more prone to sudden, intense contractions. The good news is that there are effective treatment approaches for this condition. Some dialysis centers have shown that adding magnesium to the dialysate fluid can significantly reduce both the intensity and frequency of muscle cramps. Your doctor may also adjust medications or dosages to help stabilize your electrolytes and minimize cramping. For individuals undergoing hemodialysis, severe and frequent muscle cramps are particularly common in stage 5 kidney disease and are something many patients struggle with regularly. The most important thing is recognizing when cramps may signal a dangerous situation. If cramping occurs along with chest pain, palpitations, or extreme weakness, this may indicate that potassium or calcium levels are reaching a critical range. If this happens, you should seek emergency medical attention right away. It is also helpful to pay attention to when the cramps occur. Do they only appear at night? Are they mostly triggered during or immediately after dialysis? Or do they happen randomly throughout the day? These simple details are extremely useful as they help your doctor identify the exact cause and make the necessary adjustments to reduce your symptoms effectively. Symptom 3, swelling or edema. One of the common warning signs of declining kidney function is swelling, also known as edema. This swelling is usually most noticeable in the feet, ankles, and lower legs. When the kidneys are no longer able to work efficiently, they cannot remove excess sodium and fluid from the body. The retained fluid gradually accumulates in the soft tissues, causing visible and sometimes uncomfortable swelling. It is important to understand that swelling is not exclusive to kidney disease. People with heart conditions, poor circulation, liver disease, or other kidney-related problems may also experience edema. That is why this symptom must be carefully evaluated to determine the true underlying cause. To manage swelling, doctors commonly prescribe diuretics, which are medications that help the body eliminate excess water and salt through increased urination. Another essential part of treatment is reducing daily sodium intake. Lowering sodium to around 2.3 grams per day has been shown to significantly improve swelling in many patients. Edema may appear as early as stage 3 kidney disease, but it tends to become more noticeable and more severe in stages 4 and 5. There is also a simple test you can try at home. Press your thumb firmly into your lower leg or ankle for 5 seconds, then release. If a deep indentation remains for 10 to 15 seconds, this is known as pitting edema and should be discussed with your doctor as it may indicate worsening kidney function or electrolyte imbalance. There are also certain warning signs that should not be ignored. If swelling suddenly becomes worse or is accompanied by shortness of breath or chest pain, this may indicate fluid buildup in the lungs or a serious heart-related issue. In that situation, you should seek urgent medical care. Finally, it is essential to remember that swelling does not always originate from the kidneys. It can also be caused by chronic venous insufficiency, lymphatic obstruction, medication side effects, or heart failure. For this reason, you should never adjust your diuretic dosage on your own. Changing medication without medical supervision can lead to electrolyte disturbances or accelerate kidney decline. Symptom 4. Loss of appetite. Loss of appetite is a very common problem among people with end-stage kidney disease. When the kidneys can no longer remove waste products and toxins effectively, these substances build up in the bloodstream and interfere with taste, the feeling of hunger, and the brain centers that control appetite. As a result, many patients simply lose interest in food, and even a few bites can make them feel tired and unwilling to continue eating. In fact, decreased appetite can begin in the earlier stages of chronic kidney disease. However, as the condition progresses into stages 4 and 5, the problem usually becomes more noticeable and persistent. Waste buildup is not the only cause. Several additional factors can contribute to poor appetite, including dental or digestive issues, side effects from hemodialysis, depression or anxiety, which are very common in CKD patients, and hormonal changes in the body. For those who have diabetes along with CKD, the risk of appetite loss is even greater. Long-term diabetes can damage the nerves that help the stomach empty properly, a condition known as diabetic gastroparesis. In this case, food leaves the stomach much more slowly than normal, causing a constant feeling of fullness even when a person has not eaten. Eating may lead to nausea, vomiting, or abdominal discomfort shortly afterward. It is important to emphasize that poor nutrition can accelerate the progression of kidney disease. The body needs adequate energy and protein to maintain muscle strength, immune function, and internal balance. That is why following the guidance of a nephrologist or renal dietitian is essential. In some cases, doctors may prescribe appetite stimulants such as megestrol acetate. However, patients must be closely monitored because these medications may increase fluid retention, cause excessive weight gain, or raise blood sugar levels. Persistent loss of appetite over weeks or months is quite common in advanced kidney disease, especially in stages 4 and 5. However, there are certain situations that should be treated as warning signs. If you lose weight without trying, or if you cannot keep food down for more than 24 to 48 hours, you should contact your doctor immediately to prevent malnutrition or dangerous electrolyte imbalances. At home, you can monitor your condition by checking your weight once or twice a week and keeping track of how many meals you are able to complete. Bringing this information to medical appointments provides valuable insights for your doctor and dietitian. You can also try simple strategies to help maintain your nutrition, such as eating small but frequent meals, choosing nutrient-dense snacks, or using kidney-safe nutritional shakes. For many patients, these methods are far more manageable than trying to force themselves to eat 3 large meals a day. Symptom 5. Itching. Persistent itching, also known as pruritus, is one of the most common symptoms experienced by people with end-stage kidney disease. In fact, more than 40% of dialysis patients struggle with this problem, and for some, the itching can be so intense that it disrupts sleep, affects mental well-being, and severely reduces quality of life. Modern medicine has not yet identified a single definitive cause of this condition. However, researchers believe that kidney-related itching results from a combination of factors, including elevated inflammatory molecules in the blood, overactivation of immune cells, imbalances in opioid receptors in the skin and nervous system, and the accumulation of toxins and electrolytes that the kidneys are no longer able to remove efficiently. When these issues occur at the same time, the skin becomes far more sensitive and easily triggered by even minor irritation. This is why itching in CKD patients often feels deep, persistent, and difficult to relieve. Symptom 6. Shortness of breath. Shortness of breath is one of the symptoms that can cause the most fear and distress among patients, and understandably so. The sensation of not being able to get enough air can lead to panic and serious discomfort. In medicine, this condition is referred to as dyspnea, and it can be a sign of severe kidney disease. There are several underlying mechanisms that contribute to this symptom. The most common is fluid imbalance. When the kidneys fail to remove excess fluid from the body, this extra fluid can accumulate in the lungs, a condition known as pulmonary edema. When the lungs fill with fluid, there is less room for air to flow freely, and even simple activities can leave you breathless. Shortness of breath can also result from changes in pressure within the pulmonary circulation. Pulmonary hypertension or scarring within lung tissue can reduce lung elasticity and make breathing feel labored. Additionally, anemia, which is extremely common in chronic kidney disease, can contribute significantly to breathing difficulties. When red blood cell levels fall, the body receives less oxygen, causing shortness of breath, especially during movement or while climbing even a small number of stairs. Symptom 7. Cognitive decline. A commonly overlooked yet critically important symptom in end-stage kidney disease is cognitive decline. Many patients describe this as feeling mentally foggy, having difficulty focusing, or experiencing unusual forgetfulness. In more severe cases, individuals may struggle to make decisions, absorb new information, or may even show symptoms resembling dementia. These cognitive changes are not simply the result of aging. Instead, they are primarily driven by the buildup of toxins and metabolic waste in the bloodstream. When the kidneys can no longer adequately filter the blood, these harmful substances circulate directly to the brain. Because the brain is highly sensitive to internal chemical changes, its function becomes impaired, leading to noticeable issues with memory, attention, and mental clarity. Symptom 8. Breath smelling like urine and metallic taste. Another surprising but important sign of advanced kidney disease is breath that smells like urine, often accompanied by a metallic or unpleasant taste in the mouth. This symptom is closely associated with elevated levels of urea in the bloodstream, a condition known as uremia. When the kidneys can no longer eliminate waste through urine, urea and ammonia accumulate internally. These compounds can then be released through the breath, causing what some patients describe as a urine-like or ammonia-like odor, even if they maintain excellent oral hygiene. In addition, many patients develop a persistent metallic or bitter taste in the mouth. In medical terms, this is called dysgeusia. It can occur due to changes in saliva acidity and composition, reduced salivary flow, toxin accumulation within body fluids, fluid imbalance, or inflammation of the oral tissues. These disruptions alter the way taste receptors function, making food seem bland, unpleasant, or distorted. As a result, eating becomes less enjoyable, which can worsen appetite loss and contribute to malnutrition in individuals with advanced kidney disease. Symptom 9. Changes in skin appearance. Skin changes are another common sign of end-stage kidney disease. Approximately 40% of patients develop noticeable discoloration or unusually pale skin, which often results from anemia. In contrast, some individuals may experience a darker complexion or hyperpigmentation. This occurs when the body can no longer regulate certain hormones properly, leading to excess pigment in the skin. Improving hemoglobin levels through medical treatment can sometimes help with this issue, and sunscreen may prevent pigmentation from worsening. A yellowish tint to the skin may also develop as waste products that normally give urine its yellow color begin to accumulate in the body. This can cause a subtle but visible change in skin tone. Severely dry skin, known medically as xerosis, is also frequently seen in end-stage kidney disease. Although the exact cause is not fully understood, experts believe it is related to reduced activity of the sweat and oil glands. As these glands shrink and produce less moisture, the skin becomes dehydrated, tight, and prone to cracking. Fortunately, there are several ways to manage dryness and discomfort. Bathing less frequently, using gentle cleansers, and applying moisturizing creams can help maintain skin hydration. It is also best to avoid fabrics or products that irritate the skin. If the skin changes are severe or cause discomfort, a dermatologist can offer personalized treatments to improve both appearance and quality of life. Treatment options. There are several treatment approaches available to help you manage your condition depending on the stage of kidney disease and your overall health. Medications remain essential in both chronic kidney disease and end-stage disease. Their primary goals are to control symptoms and reduce complications such as high blood pressure, fluid retention, anemia, and high blood sugar levels. These medications help stabilize the body, but it is important to understand that they cannot replace the kidney's filtration function once the organs have failed. Kidney transplantation is considered the best long-term option for end-stage kidney disease. A healthy donor kidney can free a patient from dialysis, extend life expectancy, reduce cardiovascular complications, and significantly improve quality of life. However, a successful transplant requires a compatible donor, major surgery, and lifelong use of immunosuppressant medication to prevent organ rejection. Patients must only pursue transplantation through legal and ethical medical systems. Illegal organ trade is a serious violation of human rights and should never be considered as an option. Dialysis becomes necessary when kidney function has declined to the point where the body can no longer remove waste and excess fluid on its own. This treatment artificially filters the blood to keep the patient alive. There are two primary forms of dialysis. Hemodialysis uses a machine outside the body to clean the blood, usually performed at a treatment center 2 to 3 times per week. Peritoneal dialysis uses the lining of the abdomen to filter waste inside the body and is often performed overnight at home, offering more flexibility. Although dialysis is highly effective at sustaining life, it does not fully replace natural kidney function. Lifestyle modifications are the safest and most sustainable approach, and they should be applied at every stage of kidney disease. A kidney-friendly diet with controlled protein, sodium, potassium, and phosphate helps reduce the stress on the kidneys. Regular physical activity improves blood pressure, cardiovascular health, stamina, and fatigue. Quitting smoking and controlling blood sugar and blood pressure are also crucial to slow disease progression. When applied consistently, these lifestyle changes can delay the need for dialysis or transplantation, prevent complications, and protect your remaining kidney function for as long as possible. Maintaining a balanced diet, drinking the right amount of fluids recommended by your doctor, staying physically active, and managing key risk factors like high blood pressure and diabetes can make a tremendous difference in slowing kidney disease progression. These simple daily habits can greatly improve your quality of life with chronic kidney disease. It is equally important to follow up regularly with your nephrologist. Ongoing guidance and timely treatment adjustments are essential to protect your kidney function for as long as possible. We have now reached the end of this video, and I want to thank you for spending your time with us today. The most important takeaway is this: recognizing and understanding the warning signs of end-stage kidney disease early can empower you to stay more comfortable, manage your health more effectively, and reduce the risk of serious complications. Symptoms like fatigue, itching, swelling, or shortness of breath are much easier to control when you track them closely and communicate openly with your doctor. Whether you are undergoing dialysis or focusing on nutritional and lifestyle changes, remember that small, consistent steps each day can create meaningful improvements over time. By taking charge of your health, staying informed, and seeking proper care, you can maintain better control over kidney disease and protect your overall well-being. We truly hope this video has provided valuable information for you or your loved ones on this journey. If you found this content helpful, make sure to subscribe to the channel and turn on notifications so you never miss an important update. Before you go, I encourage you to explore more of our videos. We share kidney-friendly strategies and practical food alternatives that allow you to enjoy your meals without compromising your health. I look forward to seeing you in the next video. Stay informed, stay proactive, and stay well.